Thank you for the invitation to participate in the CRE Conference 22, and so nice to have everybody back and seeing everybody since last year. So my name's AJ Singh. I'm the director of the Hospitality and Tourism Management Program at the University of Texas Rio Grande Valley. It's a relatively new program. We're just going into our 4th year. And essentially, it's a bachelor's degree in hospitality and tourism management with 4 concentration areas. The 3 are the traditional concentration areas of lodging, food and beverage, meeting, event, and destination management. But we've also introduced, and thanks to my colleague, friend, Dr. Micoo, the idea of introducing healthcare hospitality. He's done a lot of work in this area. I'm in this area, but certainly talking with him and others, I found that there's a great opportunity to create that as a particular niche. So today's main focus is why are we introducing this into our new program? And hopefully at the end of our session, we're going to leave you with like four things. One, we want to show you the nexus between hotels, hospitality, and hospitals. 2, why is this whole area of patient care experience growing? And what are the current gaps in this area, and what's being done to kind of rectify that. 3, we want to leave you with the idea that there are definitely careers to be had for people with hospitality backgrounds, both students and professionals who are being sought after to get into the hospital sector with our skill sets. And then finally, we want to end with talking about a little bit of an experiment that we're doing, working with a local hospital, Doctors Hospital at Renaissance, where we're going to do a joint project with a hotel and work with our medical school, their hospital, to try to implement some of these things. So we're going to get started with a few slides. Joining me also in our section is the Chief Academic Officer, Dr. Armour Forse with DHR. He and I have had several conversations about creating a curriculum in healthcare hospitality. And so this is something we'll also share a little bit with you in today's session. So, I don't need to harp too much about how big the healthcare sector is. Just looking at this slide kind of gives you an idea, particularly the last bullet point. The annual expenditures, in the healthcare sector are over $4 trillion. It represents about 20% of the GDP, expected to grow to about $6 trillion. So it's a huge, huge industry, spanning hospitals to medical campuses, continuing care, medical tourism, and what have you. So it's a space that certainly, there's opportunities for us, and which is why we're exploring that. This slide kind of talks about, what are hospitals and how hospitals are performing in terms of customer service currently as you compare to several other industry sectors. And this is a survey that's done by the American Customer Satisfaction Index. And interestingly, breweries are even better than hospitals. So breweries rank all the way on top, and full service restaurants. Hospitals, if you keep going down the slide, not ranked, but scored 69. So there's a lot of work to be done. This is a scale of 0 to 100. So there's a lot of opportunities there for hospitals to improve their service. And this slide just kind of specifically narrows it down to hospitals which score currently in customer service at 69. So the question is why? It's a service industry. We know that patient care is important, but why is it that hospitals have not been able to perform? So hopefully today's session, between ours and the others, we'll start to answer some of those questions. If you look at some of the rankings and the scores of hotels, the hotels are relatively better in terms of performance. The 2021 ASCII score for hotels is 73. And if you look at some of the higher end managed brands like Hilton, IHG, Hyatt, and Marriott, certainly their scores are a lot higher. So, one of the arguments we're making is that hospitality, hotels, service procedures, systems certainly have a lot of things that can be offered to hospitals, and you're seeing more and more evidence of that, where people are being hired from our sector to come and work for hospitals. So the next question on our slide is, what is the business we're in? Where's the nexus between hotels and hospitals? And so I'm assuming a lot of people who are in the audience today will have an answer to that. We're not creating a tangible product. We're not creating automobiles or toothpaste or soaps. We're creating an intangible product, which is basically service. So the term that I'm sure you've all come across over the years, and it was first coined, I think, in the 90s, in a book called The Experience Economy, and that's basically we're in the business of creating experiences, and those experiences are experiences that are created either in hotels or any service setting or even hospital. So we have this common nexus of creating experiences, whether it's for the patient or it's for a guest staying in a hotel or a customer visiting a restaurant. So there's a common area there. This slide, with some research, I was looking into see, what are some of the hospitality, healthcare type of key skills that are important in working in a hospital. And you'll be I was interested to find that a lot of these skills, if you think about it, whether it's customer service or attention to detail or multitasking or resolving conflicts, building relationships, these are the same types of skills that we teach our students in hospitality, So there's a lot of common threads there. So I'm going to stop here for a minute now, because basically, we're building up to the argument that yes, there's a commonality between hospitals and hotels. Yes, there is gaps in the hospital sector. Why is there this gap, even though we know that we want to create good experiences? We know that hospitality has been providing service and hospitality systems and procedures for a long time. So there's definitely something that hospitals can borrow from us. But why has it taken so long? Why are hospitals not doing what they're doing? And what's the change and what's the incentive for that change that's coming up? And so to talk about that is our next speaker, which is Dr. Armour Forse, who's the Chief Academic Officer at DHR, and he does a lot of work in that area. So I'm going to go to the next slide, Armour, and take it away from there.
Thanks, AJ, and it's great to be part of this group, and welcome everybody. So perhaps just to shoot right at the beginning is what happened in healthcare and why are we where we are? Well, the healthcare industry has really been designed to treat disease is fundamentally what's gone on. And we have been focused, and our outcomes have really been focused about treating you and your disease. How well you did in a hospital is based on your outcome. Did we treat your disease, and did you get cured for your disease? But part of that was missing was, well, how was the experience while you were in the hospital being cared for and treated? And while that was seen as important, it really had a backseat to what we're primarily doing, and that was treating your disease. Well, people started to be concerned because to try to match the economy that was going on, and with the funds tightening up, people worked very hard to make the system more efficient, get patients through very quickly. Length of stays in the hospital became important and was shrinking down just to try and match the economics of the business. And as a result, patients were beginning to feel that their experience in the hospital was not appropriate, that they really felt like they were just another clog in an industry wheel. The government got wind of this. The Affordable Care Act came out. And as part of that, they recognized we really need the hospitals to pay more attention to our clients, our patients, as they go through the experience of being treated. And so they began to look for a measure, and you'll see it's at the top. HCAPS is what it's called. It's a series of questions, and it's important to recognize this is a questionnaire that's actually given to patients after they've left the hospital. 2 to 3 weeks afterwards is when they receive it, and they receive it at home. So not only do they get the chance to record how they felt about the experience, but also to their family members. To make sure that people in the healthcare industry took this seriously, the government said there's going to be dollars and cents associated with this. There'll be penalties and incentives, and those dollars and cents were not insignificant. It was up to over $1 billion that was going to be at risk, a significant amount of dollars and cents. Cleveland Clinic got wind of this very early on and realized that we really needed to have people who were going to focus on this, and thus became the idea about creating what's called an experience officer. The experience officers really needed to be able to have that skill set that was missing. They needed to bring it into our industry, integrate it into the industry, and much of that is from what we would call non-medical background, but people with backgrounds in particularly in hospitality. On the next slide, you'll see the focus of this is really around a culture of service. And the first experiences that came out of Cleveland Clinic focused on safety, quality, satisfaction, and the overall value that this person would have to the industry. Identification of service problems, which we kind of already knew that were in the industry, but really came out as the experienced officer engaged with our industry. Communications, we constantly are having a problem with adequate communications between ourselves, the industry, and the patient, both while they're in the hospital and outside. Nursing rounds, and I would say that really extends to doctors' rounds too. So while people are running around literally trying to be efficient and effective in caring for the patient does not feel that they were getting the adequate communication. So people have to learn to communicate at a level that patients would actually understand. And a term that's really important is this whole concept of empathy, or merely a misunderstanding because you're working in the hospital, it's home, you're very comfortable here. But for a patient coming in, particularly a patient who's sick, it's a very, very difficult, scary, challenging place. And how do we actually make the patient feel like this is really kind of home for them while they're trying to get cared for and cured? On the next slide, we can take a look at some of the direction that this is going to, and that a lot of it was led by the scores of the survey that is out there. It's called the HCAPS. Again, a reminder that you really have to be at the high end of this score to be able to not be penalized. Most of the concern we have is being penalized. You'll see that questions are around clinical process, the patient's experience, the outcome domain, how they did, and how efficiently the system was in doing so. And you'll see questions down below which you probably would say, wow, you really are concerned about the food in the hospital? And the answer is absolutely. Patients get to answer questions as how quiet was the hospital? How comfortable was it for you? And so you can see that that type of feedback was brand new to us, and learning how to actually deal with it while we're trying to treat the patient and communicate with the patient. We really need to have someone who could help us with that integration and transition of our practice of medicine. And this, therefore, is a really key role for the experienced officer. On the next slide, you'll see some of the dollars and cents that were at risk. These are not small amounts for your industry, particularly, again, as the margins in healthcare are shrinking just because of the nature of our concern about the cost of healthcare. So while we're facing these shrinking margins, now on top of that, we have some very significant dollars that are at risk if we don't pay attention and actually address these issues effectively. 8 million to 12 million to 2 million. The smallest one, there's 2 million, but there's one $12 million potentially at risk on your healthcare margins and your bottom line. That is very significant. On the next slide, the question then is, can we get involved? Is there an opportunity? And the answer is yes. There are internships. There are paid internships that are available to bring people in for them to get an experience in the hospital. Most people who are out in the hospitality world in that direction of training and education that they are pursuing probably feel a little uncomfortable exactly what goes on in a hospital and how would I actually learn to integrate what I've learned and what I'm bringing in to see if this would be a direction I would want to go as a career choice. And so internships are a great way to do it. And yes, there are paid internships out there to allow this to occur. So one could actually say, you know what, I'm very interested in this. This would be an opportunity for me to take my career in hospitality in that direction.
So, Dr. Forse, I'll just briefly add, because this is obviously a key interest for us as we're developing the healthcare hospitality curriculum, and internships are required. So I've been doing some reading and some research in this area, and I was very, very pleasantly surprised to find at least three major healthcare systems that are providing paid internships. And I'll just quickly read, just for the audience's benefit, as we're trying to get them interested in maybe thinking about this as a area within hospitality. So the Northwell Health actually has an 8-week internship paid program geared towards college juniors and seniors who are passionate about making a difference. It allows students to expand their knowledge in hospitality and apply it in a different way that has a more meaningful impact. During the program, students partner with mentors who are patient, experienced leaders at Northwell and shadow hospital-based service such as patient and family-centered care, environmental services, food and nutrition, concierge, marketing, IT, and security. So that's very interesting. And this was just one of them. And I found the 2 others that are doing very similar things. So there's definitely a growing interest, and the skill sets that we identified earlier match very well with the types of things that our students, within hospitality can provide.
And we don't have all the answers. So I would say the other part of this is exciting is the fact that there's a whole opportunity for innovation, experimentation in this area, because truly we have a lot to learn. And, so does the healthcare profession. So part of the experience officer is not only discovering what's needed and calibrating it for the uniqueness of each healthcare institution. You would think the hospitals are all the same, healthcare systems all the same. They are not. They each have their own different characteristics. And so part of the experience officer is learning how to take this whole new area and integrate it into that specific healthcare system. And it'll be important as a part of this exercise is to train and teach the healthcare professionals and how to integrate that into their actual professional style of healthcare delivery. We actually have sessions now specifically like this, where we bring physicians, nurses in, and they sit down and talk about, okay, how do I best communicate with a patient? How do I deal with a patient who's not happy about the situation they're in? Not from the medical perspective, but because they're really uncomfortable in the situation that they're in.
Thank you all. And we'll turn it over to the next speaker now.
Hello, everybody. Good morning. It's very exciting to be again with all the distinguished panel members. Thank you, Dr. Singh. Thank you, Dr. Forse, for this great jump start here. And Dr. Micoo, thank you so much for being part of this very interesting program. I think you laid the land, tell us exactly the problem. Now I'm going to bring the solutions, and we talked about part of it. Is educating people and to have very good news for everybody that healthcare is and hospitality is expanding as a labor force is growing significantly. The January data showed 151,000 new jobs created in leisure and hospitality. So this is real. And what I'm proposing here is a very practical solution that could be implemented everywhere, whether in a new hotel and on campus that you have or with us. Go ahead to the next slide, please. So we know we're in the COVID world. We're probably getting to see where we can adjust to changes in addition to the regular background of whatever the usual healthcare needs are. The COVID is endemic. It's probably here to stay, and it's probably going to be like the regular flu every year. And we need to emphasize and assure all the graduates and so on. It's a very interesting field that will require the human interaction, empathy, compassion, and healthcare. And yes, it is about the customer service that will keep the business, growing and maintain your client, kind of loyalty. Next, please. So we're going to, I know there's going to be an element of AI, and I know there's ongoing discussions in the industry and both clinical, as well as in the folks in the private sector. AI may facilitate. We could use this as as an opportunity to help coordinate the patient's travel, wellness, diet, nutrition, and you know what? It ends up with the same goal, which is improve, consumer experience and satisfaction that will help them to, hey, this was a great experience that I have, and bring in new customers and so on. Next, please. So we need to do three things. First, obviously, and in anything, of course, including the evidence that we know from COVID, we need to test people, triage, and treat. And we know for a fact that the treatment options with the hospitals being overwhelmed, we've got to create an alternative treatment facility. And I'm going to give you some really breakthroughs that is happening so quickly now. Go ahead, please. Next. So FDA approved home testing. We already know that and get it for free. And approved 2 new oral anti-COVID therapy that you could take at home. So you test at home, it's positive, you can start therapy at home. And this is, again, for low and medium risk folks. And this could be done at home or in a hotel. With the overlap, again, if someone have to be traveling and then, have symptoms and have low risk category, they can have a safe quarantine right then and there in the hotel. So that requires hospitality skills. And of course, on-site, clinics like Pronto Care. Go ahead. So here's the deal. We know that, patients or clients or visitors or guests would need to have, showing care about their wellness, about their well-being. That's a must. We already know there is proportionally increased high clients rate that are advanced in age, and those are the clients that everybody's trying to attract in their hotel industry. And of course, they will have comorbidities, existing healthcare conditions that they would require definitely education about improving the hygiene and strengthening the immune system, and really maximizing overall wellness of the clients, and to feel, hey, this place really cares about us. And this goes back to your topic that you talk about is this place care about us, or just like flipping people, patients or clients for that matter. Next, please. So this is just a brief kind of video. We're not going to run it, but I would just to kind of put all this together in a very brief, 30-second video that will tell people exactly about the model. I will just skip it. I just need people to be, excited about it, and they can go and then they can actually see it and know what's out there for them as an additional bonus to. Of course, you will have fun. You will enjoy the travel, but you also want to have a safe environment and a healthy environment and a wellness, promoting environment. Next, please. So I would, again, kind of rehearse the model that's developed in Pronto Care, specifically as proposed franchising on-site for hotels, resorts, spas, that will really address all those needs for clients in one place. We could have the ongoing one-way traffic where they can be evaluated and tested, and see if there's high-risk categories that may require a patient to be deferred to hospitalizations or higher care. If it's just a low or moderate risk and it's positive as far as the test, then maybe having a safe quarantine and also therapy that could be initiated on site at the hotel, with the Pronto Care clinic kind of facilitating both the progress as well as the kind of follow up on the client's conditions. Next, please. So, I want to tell everybody in the healthcare hospitality, it is great news. AI is not going to take over your job. It's basically, it's very secured. It's very growing. We know now that there is definite need, and everybody have already, realized that. And then the bigger institutions have seen that earlier, but everybody is now learning that healthcare and hospitality, there's such overlap, and they have to be available and have to be right then and there when needed. So that's a must be available for all the consumers for that matter. Next, please. So I wanted to get that job secured security message that in the Pronto Care model, we emphasize on the human impact, human interaction. And of course, that would relate to both clients' experience, would relate to outcome, and would relate to later on to obviously business and dollars in being generated rather than being penalized. When Dr. Forse was explaining, if the consumer is not happy, then it'll this will be a lost opportunity. Next, please. So again, no matter how you cut it, it's all about wellness right now. And if this important element is being incorporated in an overall hospitality vision, I believe this will be a great attraction to clients and consumers to promote that hospitality for their facility. Next, please. So we're talking about coordinated medical care. We need to have safe quarantine. We really need to know most of the hospitals for the most part in the U.S. and we've seen this over and over and over the past 3 years with the pandemic. They're overwhelmed. They're stretched to the too thin. So we need to unload that, and then we're going to unload it in a safe environment. I believe when the hotels are start for business, then they could be accommodating the low and moderate risk clients and save the hospitals for the one who are really critical and high risk, and those who would need complex care. Next, please. And Pronto Care can facilitate the algorithm as well as the triage, so the clients will be taken care of appropriately rather than going and make all those ER visits and hospitals visits, and it's probably not needed or risky for that matter. So it'll be a great win-win for the hospitals to be able to see, okay, I'm joining up right now, sending somebody to the emergency room, to the hospital after being triaged and so on. And I think this patient is already have been worked up and at high risk, so they'll know this is not just here for testing or some insignificant clinical finding that they will not require further in-hospital care. So this will be a great model to consider. We're certainly looking for partnership with collaboration with Dr. Singh, Dr. Forse, and anybody who would like to be a part of this to really ultimately translate into great customer service, into great wellness, and ultimately outcome for the visitors, and for the hospitals to unload those overwhelming facilities with burdened with patients and so on. They could be a great unload, and a great connection in the healthcare hospitality, and certainly look forward for any collaborations, course, involvement, because I believe this is the innovative model for the solution to both healthcare and hospitality. I'm going to stop here, and Dr. Micoo, I think you're going next.
All right, thank you, Dr. Eldin. That was fascinating. And you and I have talked about this model, which is a preventative model, and is actually in use in the Tampa, Florida area. So we also have written a paper on this Pronto care, bringing it into a resort spa as another offering, particularly for international travelers that are looking for the well-being and the safety net of having the medical at the resort. So very good. And thank you, AJ. At the beginning, that was a great overview. And Dr. Forse, good to see you again. As you know, I had the opportunity about 5 years ago to be the consultant on that project there at the Renaissance. And very exciting when I wrote my report. And then AJ took it over. But it included the hotel for medical tourists, medical travelers, particularly maybe from Mexico, so they wouldn't fly over the Rio Grande Valley up to Houston and Dallas, but would stop there. But also the hospitality school as an integral part of that hotel and of the Renaissance Medical Campus. So it's a great model, and I'm glad to see it's moving forward and just fabulous. And I want to thank the WF3 team for inviting the four of us back 1 year later. And it's a fascinating topic, and it's a lot of information. I know we really just scratched the surface, and there's a lot of depth that we have knowledge on, and we're happy to share that. So what I want to do today, and let's see if I have control of the slides or if somebody can advance to the next slide. AJ, I think you have.
I can do that, Fred. If you just let me know next slide, I'll move it.
Yes, go right ahead. All right. So I really believe there are abundant careers in this hospitality to healthcare. I call it H2H. We kind of coined that term about 8 to 10 years ago, H2H. And, I first called it hospitality to healthcare. But I've changed that to hospitality to health. And why is that? Because if you think about it, it's an umbrella for many different subsets of hospitality. For example, I teach a spa and well-being management class here at Northern Arizona University every fall. And that's part of this H2H health umbrella. And many of you know that's a very difficult position to fill, a spa director, spa manager. If you talk to Marriott, Hyatt, all the big companies. But our students are really well equipped to manage that spa area as a finance center, a business center within a resort or a hotel. So that's an example of this to help. Of course, it also includes medical campuses. And a lot of medical campuses are building hotels because they want people to come to the medical campus and be an outpatient, let's say, go back, get the treatment, go back to the hotel to stay. So that's a whole new area. And our students of hospitality are really well equipped to manage this. So what are some other areas? Last week, I visited a upscale senior living community in the Scottsdale, Phoenix area. They want our graduates. And as you can imagine, these active adults that move in are looking for, entertainment, great dining opportunities. And of course, our hospitality students are very skilled in offering a very high level of service. And I'm reminded that Dr. Eldin, we have a saying, he came up with it, but I borrowed it. He knows this. Putting the hospitality heart in health care. Putting the heart back in healthcare. And certainly, Dr. Forse gave some great examples of how we can do that. So let's go to the next slide, AJ. So this is a website, and you can see the link up on top. It's called globemed.education. And we've developed this website maybe 5 years ago with the help of my colleague, Dr. Tim Muhitten, and many of you have submitted articles. But I'm going to suggest to you, and I'm reading some of the chat, some of the Q&A. You're looking for materials. I think this website, the globemed.education, it's free, has a lot of the articles that have been written. We're also happy to take some of your research, some of your writings, and put this on the GlobeMed. So I like to think of this as kind of a repository of this H2H material, the hospitality to health. And all we're doing, bridging healthcare with hospitality. And again, as Dr. Forse and AJ said, and Dr. Eldin, it's about the patient/guest experience. I kind of use that term patient-guest. We just say patient really doesn't bring into play the importance of that patient as a guest at our hospitality operation. And that's what we're trying to do, create a wonderful experience. Of course, we want to have great care. But if you think about it, patient comes into a hospital, has a procedure, it could be an operation, and then goes back to recover. Well, 70-75% of those services in the recovery are hospitality related, right? So the dining, the transportation, the environmental services, the room services, those are all hospitality. And we have such great examples of people that have left, say, the lodging industry, hotel resort industry, and have gone into healthcare. And I've written on this, and you can find it. I believe it's on Hotel Online, and it looks at one of our former students that went from Ritz-Carlton, a global position with Ritz-Carlton, and now he's the director of hospitality health for a major medical campuses in the Midwest. And if you want that article, I'm happy to send it to you. Let's go to the next one. Next slide, AJ. Okay, so when you click on that link, this is the page you'll come to, and you can see at the top, education and training, research. If you go to research, you'll see all the articles. And then we have some other topics that we've covered. And I even have in there a syllabus for a course I taught on H2H at Colorado State University. So if that would help you, by all means, use it. But it is a guide, because somebody asked, I think it was Kim, as far as curriculum. So that's one of the courses I've taught. And I try, thanks, Kim. I try to bring in my spa management class, spa and well-being. I try to bring in the H2H and talk about some of the innovations, including Pronto care in a resort spa, for example, as one way to use that Pronto care preventative health model, which is a wonderful innovation that Dr. Eldin has. So this is the great page. There's a lot of information. I know you want information out there, and we're trying to give that to you. If you go to the next one, AJ, I want to try to wrap up quick, leave some time for questions. We'll go to the next slide. Here's one that I wrote with Dr. Abe Pazam at University of Central Florida Rosen College. I'm sure many of you know Dr. Pazam. And it was looking at retirement communities and opportunities for hospitality. Again, that would be under that umbrella, right? You know, because a lot of retirees, active adults are moving back to campuses, and they're looking for great well-being experiences, great dining, exercise, healthcare. So we talk about that. And also at the end of this article, Dr. Pazam and I, we talk about opportunities for hospitality students, which are abundant. AJ, go to the next one, please. Well, go to the next one. This is an article that came out in Hotel Online last week, but it was looking at the Apple glasses and how we might be able to use these in healthcare to get to know our patients better, or patient guests, if you will, better, by using this Apple Glass product. So it's a good article. It's kind of futuristic looking, but think about someone coming into a patient guest room and knowing about their history, their family history, where they live. It can really personalize the experience. So that's what I wrote about in the article. Next slide, please. Another one you'll find in hospitality that looks at robotics. And I was working with a company called Bear Robotics. They're out of Austin, Texas. And they're actually using robots now in senior living facilities to help deliver some of the food in the dining room, but also to their apartments. Next slide, please. So the next one, I think, just gives the reference. Yeah, Hospitality Net, there's the link. And you can look at it if you're interested in that. Next slide, please. I think this is next to the last slide. AJ, if you can. Okay. So again, in summary, there are great opportunities in the hospitality to healthcare space. If you think about it, during the height of the pandemic, so many people in the hospitality, lodging, restaurants were furloughed, lost their job. Million, I think it's 1.something million will not return to our industry. But you know, the healthcare industry is pretty consistent in terms of employment, whether it's in hospitals, medical centers, or senior living facilities. Even spas did pretty well, believe it or not, because people wanted that human contact. They wanted to be touched. So they came to spas and the resorts. So the spas actually held up pretty well. But the point is, to summarize, is that H2H really has some very fantastic career opportunities for our graduates of hospitality school. And I'm working to, start an educator association, probably a SIG, maybe with CRE. Many of you are familiar with CRE, of course. And to share. I mean, that's what it's all about. So the GloMed website, that's there for you to use. And hopefully you'll contribute to it. So we can build this out as a discipline for our industry, because our students, the hospitality students, have a great attitude to serve, right? The spirit to serve and to give back. And so that H2H umbrella is a wonderful opportunity. I think that's the last slide. I think it's, if you just go to, okay, there's my information. There's my email if you want to write to me. And let's see, we have 5 minutes for questions. So I'll look at the chat now, but if anybody has questions, go ahead and ask.
I'll just make a quick comment. I forgot to mention this in my presentation, folks. There is a journal of patient experience. It's a peer-reviewed journal. And so those are the academics who are publishing and researching and interested in this area. May want to look at that. I just recently discovered it as I was researching things related to the Chief Experience Officer. And evidently, there's a journal in this area.
Yes, there is. And I review for that journal, and some of you would be welcome to do the reviewing as well. I do have some questions in the Q&A. So one was, can an RT-PA major concentrating as a recreation therapy major, could they also do an internship? And they have prior experience in hospitality. So I don't know the exact answer. It's a great question, because a lot of our conferees on with us today are in recreation management programs, and they have a hospitality component usually, but it's more focused on the recreation side. And therapeutic recreation is one of the concentrations I'm familiar with when I was at Penn State. So I don't know who wants to take that one. Can they do an internship? That's the question. All right.
Probably Dr. Forse, I think you could.
I would say there's no reason why they shouldn't be able to do the internship. So the answer would be yes, as a quick answer to that. I think that the design of the internship is a two-way street. It's what they can bring to the internship just as well as the hospital can bring to the internship. So I think it would be a mutual learning experience.
Yeah, I agree with you. Thank you, Dr. Forse.
And also, Fred, since you broadened the H2H to health, it's not just about hospitals, and there's the whole wellness side, the leisure side, And my PhD actually was in parks, recreation, and tourism at Michigan State. So really, there's a whole leisure side and wellness side to that as well that people can get into, and I think that could lend well with somebody with that background.
Yeah, thank you, Dr. Singh. Thank you, Dr. Forse.
Right.
Great.
The healthcare industry is going to be under pressure to be involved in the wellness of the patients that are around them. So this will be another area that's going to have financial penalties to it. So we're going to be very much involved with that concept, and this would fit into it very nicely.
Yeah, that's great. My background is nutrition dietetics, and I'm a registered dietitian. I keep that certification because that's kind of my calling card when I work in a healthcare operation. So you can see there are many ways to come into it. I think the most important thing is just, a passion, an interest, and I believe an internship is the best way to do this. So a company like Armour, and they have great internships in the healthcare setting, and they're on most of your campuses recruiting. So that would be one to reach out to for an internship. And there's such a demand for our graduates going into this area. So I think it's a wonderful opportunity. And as far as, yes, it would be good for each of us to have an intro to hospitality to health class. It's pretty rare. I did teach one. I teach a spa class where I bring it in. And I'm looking at designing a class, an online class, and that hopefully will happen in the next year or so. Let's see. I think we're at 9:50. I believe that was our ending point. I wish we had more time, but feel free to email us any questions. We really appreciate you joining us early this morning. And have a great weekend, everybody. And thank you to my panelists, our panelists. They did a fabulous job, as always. And maybe we'll see you again in a year.